I am going to show you the two certification exercise that you will be doing in a couple of weeks, okay? This is a demo that hopefully will help you prepare for it. First thing to do is to take your OSL and place it correctly where it's supposed to go on your body. Make sure that it's clipped securely so it does not fall off you. Next thing to do is to walk in the X-ray room where I will give you the exams that you will be performing. You notice I have closed my door already, and that is a very important step. Now you're going to carefully look at the two exams that that you are going to do, and once you are ready, you will tell me. The moment you say I'm ready, that means that the timer will go off and your certification evaluation begins. I'm ready, here I go. First thing to do is to sign in the system. Then is to choose the patient you're doing. And that will be, your patient will be your own name. Here you say start exam, and you look at the sheet that I've given you, and you will see the two exams that I'm asking you to do. One of them is a knee, the right knee, and the other one is a chest. So I will choose the chest, then I'll move down to the knee, the right knee, and I'll accept. The next window that opens is the technical factors window with the projections for each exam on the left hand side. I'll ask you to do first the knee, so you will choose the projection that says on your paper, and here it says it's an AP knee, so I have that. Medium adult, here I start to set my technical factors. I need to use the table bar key, and I need to use fix, not AEC. Next thing I want to do is I want to verify my KVP 75, the MA 200, and the MAS 8. The exposure time is 40 milliseconds, and it's the small focal spot. Other things that I need to verify is this exam of the AP knee, you have to do it with data grid. The SID has to be 100 centimeters, and you will be using the equipment with the key on. Once you have set up your technical factors, it's time to go in the room and set up for the first exposure. Things that I must do first is I have to turn the key on, and I have to make sure that the grid is removed. The next step should be bringing the table to a height that you're comfortable working at, which for me will be about this height. Now I want to center my X-ray tool to the image receptor. And here I have to be careful because I have to follow my table again. And it says 100 centimeters, but with an angulation of 25 degrees. So I must first angle 25, and then measure 40 centimeters. One thing that I will do just quickly is turn off the lights so you can see better this step. Here I will put my ruler to the center of my image receptor, and I will just carefully bring it to 40, and I'm right on. Once I have angulation, SID, I'm ready to center lock it, or what we call lateral detente. How do I do that? I activate the lateral detente, and I slowly bring the X-ray tool until it stops by itself, I verify my lateral detent indicator and it's green. Now I'm okay to close my detector tray. Next thing to do is to make sure that I'm in the center of the lamp, and once I'm there, I want to make sure that I'm at the right level, which is right there. We will have identified the centering point for you, so it's not too difficult for you. Once I've done that, I want to measure 2 centimeters, 2.5 centimeters from the outest point on the shadow of the anatomy, and I see that I can bring it down, and this is from side to side, and from top to bottom I want to make sure that I include the distal 1/3 of the femur and proximal 1/3 of the tibia. If I have that from up and down, then I will have enough coverage. Last thing, but very important as well, is to place your marker along the lateral aspect of the body part and in an area that does not cause a superimposition over the anatomy. Once I have done this, I'm ready to take my exposure. Now follow this way. I'll take a quick look at my technical factors, and everything seems to be the way it's supposed to be, so I'm ready to expose. My exposure should be taken with direct vision over my patient. And my exposure is taken. Now, something that you must verify is the exposure index value, and here it says it's 15.6. I will ask you, if you were to repeat this x-ray, what changes would you make to make the exposure index value be on that next exposure closest to 0? And your answer should be that you, in this particular situation, the MAS have to be changed by clicking 15 times to bring it down. But that you will only have to tell me, you won't have to take another exposure. At this point, you will move to the next exposure that is part of your examination, of your certification, and that is a chest x-ray, PA, patient erect, using the wall stand. It says to use a grid, SID of 180, KVP of 120, MAS of 5, MA 400, using AEC and the large focal spot. And I will not, and the angulation of 0 degrees, no angulation for this particular example. So first thing to do, wall stand, AEC, it says that this should be 120, and the MA is 400, large focal spot. So I'm ready for the exposure. Now I will make my way back inside. Let me grab my paper, and I will first verify if I have a grid, and the answer is no. So I will take my grid and I will place it inside the robot. Next thing is to transfer my image receptor over from the table body to the robot. Here I will make sure that I'm holding it with both my hands while I bring it over. I will first place it at the bottom, and then I will secure it with the latch that is at the top. Once it's securely placed, I want to close it all the way, make sure that it engages. Next thing to do is to bring my X-ray tube over and set it in such a way that will allow me to measure the SID. The SID is like what is written on the paper, 180 centimeters. And right now I'm at 154. So what I want to do is I want to bring it back, calculating more or less what I need, and then measuring again. And now I'm at 169, 170. I'm gonna go back, and I'm gonna see again. And I got 170, now I got 180. At this point, I'm happy with that. I close my tray, make sure it engages, and once I'm here, I will now center lock. I'll bring the height down, and I will now close my collimation to the full area of the detector. Once I've done that, I will tell me, or you will tell me that your certification is done, and that is all we need.
Yes.